my name is McKenna. I'm a student nurse from CC. I'm just going to come ask you some health history questions, okay? All right. So, what's your name and date of birth?
Diane Eller, 11/12/01.
Okay, so you're 22 years old. What are you coming in here today for?
I'm here for my yearly physical checkup.
Okay.
Or yearly checkup.
Do you have any health concerns while you're here? Anything going on lately?
No.
No pain or anything anywhere? No. Okay, cool, yeah. And then I'm just going to get your height and weight a minute.
4'11", 90 pounds.
Okay, perfect. And that'd be perfect. Okay, I'm just looking through here, just checking for immunizations. Do you need any? Do you have them all? Pneumonia, COVID?
I have pneumonia, COVID.
Flu?
I don't have it yet.
Okay, when are you planning on getting it?
This month, hopefully.
Okay.
My workplace is offering it.
Any medications now that you're taking?
Not a medication, but a supplement. I'm taking a magnesium glycinate.
Okay, perfect. What are you taking that for?
Vitamins for everything.
Okay. Do you have any allergies? Food, medications?
Not that I know of.
Okay, perfect. So I'm just looking through here. Do you do any drugs?
No.
Do you smoke?
No.
Alcohol?
Occasionally.
Okay, that's fine. Surgical history? You have anything? No surgical history? Wow, you're a healthy individual. Good for you. Okay. Any past family history with any disease, cancer?
Yeah, my dad's brother died of colon cancer.
Okay.
Not barely a cancer, but I've had my dad's side died of aneurysm.
Okay.
Brain aneurysm. Yeah.
All right. I'm sorry about that. To hear about that. So I see here you have a history with asthma.
Mm-hmm.
Did you take any medications for that? When was that you found out about that?
I had it since I was like 5 years old, and the last time I've had it was I was in 9th grade. So it's been a while since I had the last time I had an asthma.
And when does that happen usually, like any attacks or anything?
Only when I'm like going for a long walk or I'm like going upstairs, like 3 floor stairs. If I work my lungs out too much.
Mm-hmm.
I didn't play any sports back in the days because of that.
Okay.
And what I usually do is I use a nebulizer.
Okay.
I had an albuterol with me all the time, and I used to take the medication Ventolin all the time back in the days.
Mm-hmm.
Yeah.
Okay, cool.
But I never take anything right now because it's been a long time since I had asthma. I was like 9th grade.
Do you exercise regularly or?
Yeah.
Okay. And it's fine during exercise?
Yeah.
If you take your inhaler?
Yeah.
Okay.
I went on a hike. I've been going on a hike and trails, and I've never had any asthma attack. I usually can't walk for at least 1 mile without having asthma attack.
Okay.
So yeah, it's doing good so far.
Okay, perfect. High blood pressure, just asthma, no heart palpitations, no heart disease or anything?
No.
Okay. Awesome. Okay, moving on here. So you said you exercise. Is there any pain, anything with mobility that hinders you from exercise? Okay. Glasses, contacts?
Don't wear any glasses or contacts.
Okay. Had last eye exam, it says August 9, 2024.
Mm-hmm.
How'd that go? Changes in vision?
20/20 vision.
Perfect. Hearing says no. Looks good there. Memory changes. Any changes in taste or smell?
No.
Okay. Just gonna go through a history of vaginal discharge, sores, STIs. Any other like menstrual problems or anything? How is your menstrual cycle?
It's not like 28-day cycle or 30-day cycle. It's always fluctuates. I always have a normal cycle. But so far they always last like 7 days, sometimes like 10 days.
Oh wow, okay.
Yeah.
Okay.
It depends on like the heavy flow.
Okay.
So
Awesome. It says last pap smear May. Self breast exam May. Looks good. Let's see now, just for support system in your environment, who do you look for help and anytime you're feeling down or?
My significant other,
Okay.
my partner.
How long had you guys been together?
A year and 8 months.
Okay, nice. Does he live around here or?
He just moved to Nashville early this year, in
Okay.
February. So.
And how is that going? You guys still
It's
staying in
good.
touch, visiting? Okay.
So we visit each other. I visit him like after school or
Okay.
after I finish my semester, and sometimes when he's not busy, he comes in. So, starting last month, August, he's been coming back and forth during duck hunting because he does duck hunting during
Okay.
fall season and he
Uh-huh.
does deer hunting. So he's been coming back up here up in Michigan, and then after that he comes swing by at my house and see me.
Hangs out. Okay. Perfect. Cool. Yeah. Just going over some goals here. Health goals you want to achieve. Anything?
I
You're
just
looking to
want to gain more lean muscle
Mhm.
because this past few months I've lost weight
Okay.
from stress.
Okay.
So I want to gain more weight, but more of like lean muscles instead, and
Okay.
have tone muscle.
Okay. And then work life. How is work life going? Do you like your job? What do you do?
I'm a nursing assistant
Okay.
at a rehab facility
Okay.
/ nursing facility. It's a new job. My old job just closed recently during my last semester, so I'm building my rapport with my coworker and my patients. So
Okay.
far I like it.
You do?
Yeah.
Okay. Good. That's good. If you were to have some sort of stress with work, which I'm sure you do in your job, how do you cope with that stress? What are some ways you try to cope with that?
I stress eat.
Okay.
I stress eat, and I also try to spend time on my own with no phones. Just be on my own. Sometimes I go to the beach, just take a breather, or sometimes I like to read my book. So
Okay, good.
to get away with everybody.
That's good to just be able to be by yourself. That's a good thing to have here. All right, I'm just gonna go through some nutritional things here. What would your everyday diet look like?
So my everyday diet look like I always do not forget to eat rice.
Okay.
Lunch, breakfast, and dinner.
Okay.
Breakfast, lunch, and dinner. So I always eat rice and always pair them with protein like meat, eggs. I always have those. And sometimes I pair them with like side dishes like kimchi, like fermented
Okay.
lettuce, or some tofu for probiotic.
Okay. Do you eat vegetables often?
I'm a picky eater, so
Okay.
I barely eat like veggies. But kimchi, it depends on what kind of kimchi I eat. Like kimchi lettuce, kimchi like radish. So they're veggies too.
Okay. And what about for liquids? Do you drink a lot of water, sodas, milk?
I drink a lot of coffee
Okay.
and water. I used to drink a lot of sodas, but I cut them down because
that's
I've already had so much coffee, and I feel like I just need more time to drink. I need to drink more water than coffee and pop. So I've been balancing coffee and water this past few months.
All right. That's good. So you were talking about your recent weight loss over the summer. Tell me about that. How did that happen? And how much did you lose?
So last time I checked my weight, or last time I got my weight checked, I was around 97 pounds. And ever since I started my semester my last semester, when I did my physical checkup for my nursing clinical, when I got my weight, it was 87 pounds. So I lost 10 pounds because of that. And I believe that was from not eating enough, because whenever I had an exam or quiz, I get anxious, and usually I can't eat when I get anxious, especially like on the day or day before or day during the exam day. I just get nauseous and I don't have an appetite, and whenever I eat like food that I like, it tastes like, I don't know, I don't like the taste of it. It makes me nauseous. So that kind of be an added factor of like me not eating at all. So
Okay. And recently you said you've been trying to eat more protein and stuff.
I've been trying to eat more
fix that.
protein and some carbs.
All right. Dental problems? Any dental problems at all? Cavities?
I did.
Maybe when you were younger?
I did last year. I just got them all
Filled?
got it cleaned and filled.
Okay.
I got filling. Oh, and I actually got a dental wisdom tooth taken out.
Oh, yeah.
3 of them
Okay.
early January this year.
That's good. Okay. Your last bowel movement.
I think that was 3 days ago.
Okay.
I'm not too sure, but I believe that was.
Is that normal for you? What's your normal bowel pattern?
Oh, geez, like twice, 3 times a week.
Okay. Okay.
Yeah. I'm really constipated all the
Okay.
time. Yeah. I usually just
Do you take any laxatives for that or?
no, but I'm planning to take more fiber in my
Okay.
diet plate. But I usually just drink coffee to make me go. I feel like okay, I need to go. I'm like, yeah, let me get some coffee.
Okay.
Just an added
Yeah.
justification for me to get some coffee.
All right. Any urinary problems? Lots of UTIs or anything? Okay.
I think the last UTI diagnosis I had was like last year.
Okay. Good. Your hair looks. Any hair loss? Your hair looks good to me.
No.
No hair
Split
loss.
ends.
And what'd you say?
Split ends.
Or help there. Anything in skin? Maybe like eczema or anything like that?
No.
Okay.
I'm just dealing with pimples.
Yeah. Acne.
Yeah.
Okay.
Acne.
Yeah. Sleeping looks like you get 6 hours a day. Okay.
Yeah.
What's your nighttime routine look like?
I usually like study like till around like 8 or 9,
Okay.
or 9 or 10, and then I usually just get ready for bed, like wash my face, or sometimes I take a shower at night. I'm a night shower person to just help me relax, and then I just like get in the bed, scroll on my phone, watch something on Netflix till 12, and then around 12:30 that's when I start feeling sleepy. I usually go to sleep till 12:31, and then I get up around 6:30.
Okay.
So, but usually I go to bed at 12 and then wake up at 6, especially if I have a class at 8 a.m. So if I get the 6 hours of sleep.
Do you take any sleep aids or anything like that?
I do not.
Okay.
I used to, but not anymore.
Okay. That's good.
That messed up with my menstruation one time.
Oh yeah, that'll do it. Okay, my last part here is ethnicity. What's your background look like?
I am Filipino.
Okay.
Is
Is that your primary language then?
yes.
Okay. And then you speak English as your second?
Yes.
Okay. So in the home, when you're with your parents, you speak Filipino?
Mixed, because
Okay.
my stepdad is American, so.
Okay.
So if I talk to my siblings, it's mixed, but if I talk to my mom, it's Filipino. If I talk to my dad, it's English. So it's a mixed language in the house.
All right. Who would you say your parents are a good support system, or would you say your significant other, you count on them more? If you were ill or if you were in the hospital, who would take care of you? Who would you want to be by your side?
I'd say both.
Both?
But my parents more in there for like financial support and all that, but for like emotional support, I have my significant other
Okay.
that I go after or lean over.
Perfect. Well, I think that's it from me here. Well, thanks, Diane, for letting me ask you those questions. Are there any other questions you have for me? Anything else I should know that we missed or anything?
Not that I know of. I think we covered pretty much everything.
Okay, cool. Want any water? Can I get you anything while you just wait a minute?
Nope.
Okay. Then I'm going to go chart this and I'll be back in to finish this up, okay?
Okay. Thank you.
Yeah, bye-bye.